Hey gang, welcome to another episode of Beat the Bogey. I'm Mitchell Anthony, and I'm here with my senior analyst Kyle Aaron, and we're going to talk about healthcare today. Healthcare is an industry that consumers have been interested in, politicians. It's been one of the better performing parts of our economy for the last decade, and certainly been a great performing part of the stock market as well. And so there's lots of issues in healthcare that have come to the news over the last few weeks. The debates have focused upon this exciting industry and the opportunities that might exist in the stock market for healthcare need to be dissected a little bit. The news flow we have needs to be evaluated. So stay tuned. We'll be right back with another exciting episode of Beat the Bogey. Okay, gang, we're back, and Kyle, we're here to talk about healthcare today. We've got, a debate that just happened a few days ago where healthcare was at the forefront of the debate. We've had a lot of news flow over the last months from different players in the industry. We've certainly seen some great earnings starting to come out from the device industry. We've seen a lot of concerns come out about how earnings are starting to be affected by some of the payers in the industry, and they're concerned about how the changing winds in the payer industry are changing the landscape for them. We've certainly got proposals from candidates about what needs to be done, maybe to change the healthcare industry and make it better. The Democrats seem to want to do everything they can to kind of entrench us further into Obamacare or the Affordable Care Act and do whatever they can to make sure that Obama's dream or promise to America is fulfilled, while the Republicans want to essentially repeal the Affordable Care Act and get us off going in a direction that we were kind of on before Obama put his dream in place back in 2010. So let's talk a little bit about healthcare, and let's talk about the issues that are important. So maybe let's first talk by going over a little bit about how the landscape has changed since the passing of Obamacare. When exactly was Obamacare passed? Kyle, can you help us understand this a little better?
Yeah, so that was pretty shortly after Obama took office in his first term. So in 2010, they actually passed the ACA. And because it was such a kind of a big, complex undertaking, they didn't implement it until 2013. And there's other parts of it that are still kind of rolling into place over time. But yeah, 2010 passed, 2013 started.
So we've had 6 years, roughly, of Obamacare, the Affordable Care Act, playing its way into the homes of American consumers, playing its way into the business of device makers, playing its way into the business of pharmaceutical manufacturers, and playing its way into the business of healthcare insurers or the payers in the industry, and certainly playing its way into healthcare providers, whether it's a physician, an anesthesiologist, anybody who provides some sort of healthcare service. So they've all been affected by it. Some people have, and then the consumers too. Can't forget the consumers of it. We've all been affected by the Affordable Care Act. Let's talk a little bit about, now that we've had 6 years, just how has this act really played out for consumers first? How is this? Has this really helped consumers? Are consumers better off today under the Affordable Care Act than they were before we had this bill passed?
Yeah, it's a bit of a split. I think that there are certainly some consumers that are, and for the first few years following 2013, after this was kind of enacted, the rate of uninsured Americans dropped. So this was good news. So the percentage of the population that was now getting health care for the first time, that might have had a pre-existing condition that now could get coverage despite that condition, or that couldn't afford healthcare before that now was having it subsidized, these consumers were clearly beneficiaries under the law. But others, conversely, who now had to say you didn't get subsidized, now you're paying more because there's more people that are maybe higher risk being covered. So on the other end, somebody was having to kind of foot the bill, in essence, for this expanded coverage and these subsidies. So I think there's a split. Some consumers were hurt and some were helped.
Right, and so if we kind of tried to generalize a little bit, I guess we would say that the Affordable Care Act was a great boon for people who were low-income earners who were sick. People who were low-income earners who were sick, who couldn't afford health care, needed health care, suddenly had access to it because the mandate required coverage to pick you up whether you're sick or not. And it provided subsidies for people who couldn't afford it. So these people, it was a big boon for, right?
Absolutely, right.
But the consumers who got hurt by it a little bit were who? It seems like, I guess you're telling me maybe it's people who were healthy and didn't need insurance and want to pay for it, and now they've been forced to pay for it? Or people have been forced maybe to have more insurance than they want? Tell us what that means, more insurance than they want.
Yeah, no, exactly. So one of the tenets of the ACA was providing for kind of 10 essential areas of coverage as the law specified. And these are things like maternity care and other things. It kind of, if you bought a health care plan, it had to cover these certain things. And where before you could buy these kind of bare bones type plans, now there was kind of a minimum that was higher of what you had to buy. So yeah, people were having to buy coverage that gave them kind of more than they wanted.
And not only did they have to get more coverage than they wanted, and generally premiums have skyrocketed for everybody under Obamacare, and that the cost of insuring all these sick people who are now, that insurers are forced to cover, worked its way into premiums. And for some people, premiums have doubled over the last 6 years. Literally 100% increase or more in their premiums. Have occurred. Is that reasonable to say?
Oh yeah, no, I think that's absolutely right. And so yeah, if you fell within that category of being subsidized, which was about 400% of the poverty level, these hikes in premiums that resulted from this big inflow of kind of sick people and others, you weren't affected, but everybody else saw kind of massive premium hikes to help the insurers pay for all these new sick people.
What are some of the other reasons why premiums went up so much? I mean, we do know that healthcare insurance has cost dramatically more than we used to pay for it 10 years ago, 20 years ago, 30 years ago. And it can't be entirely laid upon the fact that we're covering sick people. It has a lot to do with providers have found ways to charge dramatically more money for their services than they have in the past, correct?
Yeah, I think that's fair. It's almost a bit of kind of unionization in the provider ranks to keep prices high and keep them going higher. So that's been a bit of a problem. And one of the things that the ACA tried to do was shift the payment model to providers from what it's always been, which is fee-for-service. Means that each time you go get a service, you pay a fee to these providers. And so they have every incentive to crank up the number of services that you get.
Right.
And so the ACA talked about shifting this to value-based type payments where a provider would get a bonus depending on the success of dealing with a patient or having lessened visits and things like that. This was kind of the dream and something that the ACA hoped to do. It doesn't really seem like it's happened yet, unfortunately.
So some of the upside for the public was supposed to come from the fact that we were going to shift away from a fee-for-service model for a fee-for-performance model, and have providers, have your doctor be incentivized to keep you healthy rather than keep you sick, and sell you as many services as he could to deal with a problem that you had.
Right.
And it's a little unclear why those mandates within the Affordable Care Act have not really been enacted by the payers yet. I guess this is upon the payers to shift their model for reimbursing providers for things that they do. And that has happened to some degree, but it's not happening entirely. And so there's something amiss in there.
Yeah, there's something amiss, some kind of disconnect. And, I don't know if it's, we've talked about the providers maybe kind of unionizing to an extent and holding prices up. This could be them kind of banding together against changing their service model from fee to performance. I'm not sure, but yeah, it hasn't quite happened. I'm not sure who has the leverage to keep it from happening, but it seems like it's the case.
So let's talk a little bit about what's going on in healthcare and how it's investing, or how it's helping or hurting the businesses that are at work in healthcare, because that's what we're all about, is investing and managing wealth here. And so we're trying to see, is there opportunities that exist in healthcare now because of what's going on in the industry and with political propositions and whatnot, or is there problems ahead? We know that the candidates have proposed Medicare for all, or the Democratic candidates have proposed either strengthening Obamacare to make it even stronger, or moving to a new plan called Medicare for All, which has largely been, I think, rejected thus far, a single-payer system. And at the same time, the Republicans want to dismantle Obamacare and go back to what we had. So I think that's kind of what's going on in the talk in the political environment. Do you have any comments to echo on that?
Yeah, I think you've got it right. The Republicans seem to want to go back to more of a free market model, where they let the insurance companies and other people in the industry operate the way that they see most effective in looking at their business model. So kind of less government control. This is pretty standard issue you see on the sides of the political spectrum here. And the Democratic candidates are kind of the two leading candidates at the moment seem to be kind of Biden and Warren. Warren is of the Medicare for All camp, and Biden is in the reinstituting Obama's kind of ACA dream camp. And to an extent, it's interesting to note that part of the ACA has been kind of dismantled under Trump. The Tax and Jobs Act that he passed in 2017 repealed part of the ACA. This was the individual mandate that told people they had to kind of buy insurance or pay a tax. And one of the things that many argue kind of is integral to the ACA functioning. So, Biden at least would kind of start by putting these pieces back together and going from there.
So yeah, maybe let's first start by talking about the payers and what's going on in the industry. There are the insurance companies who pay for your health care bills, pay the providers. And we know that they've been hurt by the repeal of the mandate, because this is allowing healthy people to get off the plan, and now they're stuck with the sick people on the plan. And I think we've seen statistics where some areas of the country, the payers are paying out 2 times the amount of premiums they're collecting in benefits.
Yeah.
And so they're losing big time in some areas.
Right. Yeah. It's tough for them. They're having to kind of constantly adjust their premium model to try to account for what their mix is going to look like. And yeah, in some cases they're missing on that by as much as 2 to 1.
Which has been painful. There's no doubt. This has been painful for the payers. So it's caused them to think about change. It's caused them to think about proposing new alternatives. But right now, under the current system, what it's actually causing it to happen is some of these providers, some of the payers are pulling out, providing coverage in certain areas under the Affordable Care Act, and making the Obamacare plan even more dysfunctional as a result. And or they're going to raise premiums substantially on the remaining people in the group to continue to offset what they're losing. So this is where there's kind of trouble amok in the payer industry. And is there some relief for them? Generally, the Affordable Care Act was good for payers because it caused a dramatic increase in customers for the payers.
Right.
Everybody, 15–20% of the population was uninsured before the Affordable Care Act. And now, after the Affordable Care Act, do we have a rough idea what percent of the population is uninsured? It shrunk dramatically.
Yeah,
correct?
when it was at its best point, I believe in about 2016, this was close to 9 to 10%.
Okay.
So we trimmed that significantly. Yeah, this was a big boon to the payers. Absolutely.
So they saw lots of new customers come on, and this was great for them. It was a boon for kind of everybody because as a result of more people being insured, pharmaceutical companies were selling more drugs, device manufacturers were selling more medical devices for use in their industry. So you've got the payers got more customers, you've got device manufacturers got more customers, you've got pharmaceutical companies have more customers. So that was what was good for them, right?
Right, absolutely, yeah. On a broad level, this was a boon of new customers kind of across the board.
Let's talk a little bit about the device manufacturers, because this has been the best performing part of the healthcare sector this year, as this group has moved up considerably in anticipation of some growth that people think is on the horizon. Compared to, flat coverage in most pharmaceutical companies and biotech, and kind of big sell-offs in the payers over the last year, if people worry about that industry
Right.
Being in decline with new regulations. So let's talk about where the bright spot has been, at least in the stock market, which is device manufacturers. How has their world changed under Obamacare first? What's different for device manufacturers under Obamacare?
Yeah, so they've been dealing with a couple of things. Certainly, they've gotten this influx of customers as a result of the expansion of coverage to more people. That kind of being in the pro category, but on the con side, they've been dealt a special tax that's directed at their industry, what they call an excise tax. Thankfully, this has been suspended for a few years, but there was a small excise tax that's going to be levied on their industry. And then also, the ACA kind of changed the structure of how devices are approved and made this approval process a little bit more stringent. So it was arguably harder to get devices to market.
So devices have had pros and cons. On one hand, the device manufacturers have had headwinds in that the government decided to hit them with an excise tax to help pay for putting all these kind of lower income individuals on healthcare coverage through government subsidies, and they needed to collect that back in the form of additional taxes. And they did it, one, with an excise tax on the sale of medical devices. And so punitive to them. They didn't do this to the payers, they didn't do this to the pharmaceutical people, but they did it to the device manufacturers.
It's interesting how it only hit them. Unclear with bio and general pharma why it might not have happened there. With the payers, they were constantly dealing with the uncertainty of pricing out their premiums. That's a difficult model. Even with the inflow of people, they had to figure out, and we've seen this kind of 2-to-1 payout, how much should we charge? Like, what is our risk pool going to look like? So that was difficult. So maybe reasonable that they didn't slap them with an excise tax. But the medical devices, this was just, here's more customers. Why they, of the other three, bio and pharma, got hit with this tax, a little unclear.
Right. So this was the headwind, an excise tax. And the question is, has there been enough innovation with great new products for them to kind of just swallow the excise tax and justify the high valuations these stocks have in the market? This is the most expensive group in healthcare. These companies sell at PEs of 20 or 30 or more, and with PEG ratios that are only in the with PEG ratios that are high, I guess, that are in the 2 or more range. So they're selling at 2 times their growth rate. So concerning how they're valued, so there needs to be some great growth on the horizon to overcome the excise tax and to justify these valuations. Is it? What are the exciting, where's the innovation in devices going to happen? They've talked about new devices to assist surgeons robotically, new catheter devices to help do more surgeries through catheters, ablation techniques that help people with afibrillation, devices that help a surgeon identify nerves that are under the skin, so when they're injecting Botox in people's cheeks and foreheads and whatever, they can avoid hitting a nerve.
Yeah, it could be, it sounds like just kind of generally, technology is kind of always increasing, and it seems like it could be the case, and maybe investors are anticipating that as technology has been improving, it's now going to really hit in the device industry and allow these technologies to kind of do really impressive things that they've never been able to do before, and the growth curve is going to kind of go hyperbolic. Certainly you're seeing a renewed interest in kind of health tech, or a new interest in health tech with wearables and things, and even to the point of clinical trials and this mandate that was under the ACA of kind of more stringent testing requirements before a product could be released. The way that technology has improved and everybody's kind of more able to record and access health data, these trials have been easier to undertake because you've got an Apple Watch that's monitoring you all day. The availability of data in the health and technology space has made it really kind of interesting.
Yeah, and so this great growth that people think is out there and all this innovation that we hope to have has drawn in some of the big great players, right? I mean, traditionally, Abbott Labs, Medtronic, Stryker, a lot of these companies who are device manufacturers have been a little bit humdrum, certainly don't have the kind of pizzazz and pizzazz that you've had from sizzle from an Apple computer or Google, but now all of a sudden Apple computer is become a player in medical devices, and Google has become a new entrant. So these great innovative companies are in there saying, hey, there's things to be done here, and we're going to start to imitate around what some of these players were doing already and make it better.
Yeah. I mean, Apple, in selling their Apple Watch, when they have their product day and show all the new stuff off, when they sell the watch, it's all about they've got people being interviewed that say this thing saved my life because it's tracking my heartbeat or whatever. And it is a health device, and that's how it's being sold. So yeah, there's new players coming in doing exciting things with medical devices.
Yeah, it's interesting. You look at a company like Apple and watching what they do and how they've done it over the years. And Apple Computer has never been a company to lead the industry with new ideas. In fact, Apple Computer did not invent Windows. That was invented by Microsoft, but they just made it a whole lot better. And so much of what Apple has done has been imitation. But once they find something that's been done, they come in and do it a whole lot better and make so much better products and so much money doing it, as we've seen them do with watches and computers and phones. So it makes you start to wonder about healthcare, because they've been watching what some of these players have done, and they're saying, all right, you guys led the way, now let us come in and kind of take over the industry and really make great products that doctors and surgeons and consumers just love to death, and all of a sudden it really does solve some real problems.
Yeah, you've got, Apple is clearly intricately linked with its phones and watches and other things to kind of the consumer's everyday life. This is the thing they interact with maybe the most, is their Apple product. So when Apple starts to get into the healthcare part of a person's life, this could be great things happening.
So let's talk for a minute about pharma and biotech. This has been a hot and cold area of the marketplace and in the economy over the last 20, 30 years. Pharma was hot as a pistol, white hot in the 80s and 90s with great innovation, great new drugs that lowered blood pressure, lowered cholesterol levels, had people living longer, and and then suddenly they started. Traditional pharma had some problems with success in the labs, and they kind of innovated everything they could in terms of kind of fixing problems that are broadly there in America and in the globe. And so they went through kind of a cold period of innovation in the new millennium. And biotech came in and started innovating with drugs that kind of encourage your own immune system to defeat cancers and things like this. And so the biotechs went through a great period of innovation. And but now both groups have come under pressure in terms of they're making too much money, the prices of their drugs are too high. The stocks have come down dramatically as people worry that they're going to be attacked by the politicians, and still the unknowns of what sort of innovative power they have. Is this a group that's we should be buying here? Is this a group that we should be selling? How do we weigh this all out for traditional pharma and biotech?
Yeah, it's in the final analysis, it does seem a little bit like there might be too much risk and uncertainty. I think, like you say, the political risk. The refrain is constantly about high prices for these drugs, and particularly in the biotech space. And this kills innovation if you can't trust that you can spend years and tons of money developing a great product, and not going to get fought by the market to keep your price down. There's no innovation there. That's a big risk to innovation, and both sides, Democrats and Republicans, seem pretty bent on going after pricing. So that's a bit of a concern, I think, for both pharma and bio. One of the interesting tailwinds that you kind of can look at, though, is obviously we talked about more people having access to healthcare, which was a boon, but also just the demographics of our country. And we're an aging population, and we're a living longer population. So to the extent that people are taking pharmaceuticals, biodrugs, there's a bit of a boon tailwind from that.
So our aging population is going to allow some of our traditional pharma companies to maybe sell more of these statins and some of their commonplace drugs to a broader part of the population. So this is opening up the door for growth for them, correct?
Yeah, that's it. So we're going to have, I think we've got some stats here. So in about the year 2000, we had about 12% of the population was age 65 or older. This is forecast to essentially double by 2050. So we will have an older population, which is presumably going to be using more of these drugs. And then in addition to being older, we are kind of living longer as a result of technologies and drugs and things. So we have more people using them, and they're using them for longer. So that's, could be a boon here.
So that's the upside for the drug companies. What do we have as kind of earmarks that there's some good innovation going on? I think we did see some data from the FDA that showed that approval of novel drugs was up something like 30% over the last year.
Yeah.
And so that tells us they had some success in the lab, and hopefully that's going to continue in the next few years. But we've started to see the approval of new novel drugs by traditional pharma and biotech growing here again.
Right. Yeah, that's exciting. I believe this was the biggest one-year increase in approvals of novel drugs, and these are things that are either using an existing drug for a new purpose that it's never been used for before, or a brand new drug coming to market. So that could be exciting. This could be opening up whole new avenues of growth and use of drugs.
So what's happening in the world of biotech, and are they adequately protecting themselves with patents? Are they vulnerable to patents that are expiring? One of the things that we have learned about biotech in our research here recently is that they seem to have better protection of their drugs than traditional pharma, and that they've kind of built a thicket of patents that make it difficult for generics to come in and reproduce their drugs at lower prices,
Right.
because of the way biotechs work. Isn't that right?
Right. Yeah. There's a couple things. The patent thicket, as you say, which is interesting, and this is kind of there's the bio space has a bit more complexity around their products, and so in over the years after a product comes to market, they tweak parts of what you do at this stage of usage or whatever. And so you have the original, patent at the introduction of the drug, which has its lifespan. Then you've made this tweak, and you've now extended kind of the lifespan, but you're still operating with, in the same environment with this bio. So you've created this kind of thicket of patents along the way, which is interesting. And then in addition, within kind of generic pharma, these generic drugs it's pretty straightforward. In terms of what's being produced, and it ends up being very inexpensive when the generic becomes available of whatever brand name drug was on the market. It tends to cost 5 to 10% of what the original brand name cost. But in bio, what they call a biosimilar, the kind of copycat generic product, it ends up not being nearly as inexpensive. In fact, it's 60 to 70% on average as expensive as the brand name. There tends to not be this incentive to really kind of go that path in the bio space.
Right. I think you've got that right. And so we know biotech is protecting themselves with better products, that they've got these thickets set up to kind of create a strong economic moat around their businesses. So it really does come down to pricing and pipeline, and in terms of evaluating what the outlook is for these highly valued companies. They're not as highly valued as they've been historically, but they've always been a highly valued industry. And so is this the time to be a buyer of biotech? A little challenging, I think, right now, given that we've got an election in front of us, pricing's being talked about. They've mostly got innovation happening for kind of orphan drugs that aren't widely used, and so if they can't get high prices for these orphan drugs, they're just not going to make a terrific amount of money on them. There doesn't appear to be any new drugs in the pipeline for traditional pharma or biotechs that have broad use that they can sell to millions and millions of Americans. And so the money's made by selling at very high prices, which seems to be a challenge right now.
Right.
With Democrats, and Trump seeming to be aligning against drug companies. And so it's hard, I think, to get excited about this group right now, given the political environment, given the kind of lack of success that they've had in the labs, and given the growth rate that they actually are achieving in the marketplace right now as well.
Yeah, I think that's fair. I think that all kind of sums up to, like you say, maybe not being particularly interested in the bio industry at this moment.
So when we try to kind of look at healthcare in general, just to summarize a bit here, we've got the payers, the United Healthcares of the world and all of their competitors. That's one strong part of healthcare that's clearly under attack here. Clearly the fundamentals for their businesses aren't as good as they've been. This is an area of the world that's had tremendous subscriber growth and more clients over the last decade, but that's seemingly peaking here. They've got the individual mandate gone. That industry doesn't look really great right now. Then you move on and you say, all right, let's talk about pharma. We just did. That industry looks lukewarm. We've talked about devices and all the great things that are happening there, but we also know there's an excise tax on this industry, that there's headwinds in that form, that this is the highest valued industry, because this is the one industry group within healthcare that seems to have some pretty good demand behind it, is highly valued, and we're not quite sure that the pipeline of innovative products is going to justify the valuation. As we said earlier, I think PEG ratios are 2 to 3 or more in this industry.
Yeah, that's the interesting part. Is it's more highly valued than it has been in a decade or more, and they're going to need to see kind of growth like they've never seen before in earnings to justify their prices. And it seems like some of these new areas of growth, like what might be happening, maybe it's a bit nascent. I'm not sure if it's going to actually come to fruition. And in that case, you get burned because these things are expensive.
So there you have it, gang. We've tried to focus the issues of healthcare here. We've tried to summarize them for you. There's this is an area we could talk about all day long, and we'll certainly be back to talk about it again. But I think we hit on some of the more important points that affect consumers, that affect investors, that affect the political environment. And so now the challenge is to try to synthesize some of this data into some decisions for the portfolio. We think this is an industry that needs to be underweight in a portfolio right now, given the environment that lies ahead politically and given how these industries are valued. So with that, we're going to say goodbye, and we'll encourage you to tune in to our next episode of Beat the Bogey.